Hello, my name is Faustina Ikizi, an Indiana State University nursing student. Today, I will discuss the rising incidence of suicide in America. This is part of my clinical health education project for NAC 444 Community Health Nursing. The population at risk for this topic are young Native Americans and non-Hispanic white populations, as well as middle-aged men from 45 years and older men, including violence and access to firearms. Please click on the link above to check your knowledge on this topic. Learning objectives. At the end of this presentation, learners will be able to understand current suicide rates and the risk factors that lead to them, identify the warning signs of suicidal ideation, recognize the mental health emergency and determine the best course of action, identify suicide intervention and treatment options, including helplines and how to assess them, recognize the implications of suicide on a person's family members and the general public, promote a suicidal-free lifestyle, and educate the public on healthy and safe coping strategies. Encourage healthcare providers to use culturally appropriate intervention techniques with a society-diverse population, and encourage collaboration among healthcare experts in research and development to help minimize suicide ideation and death in America. Statistics. Native Americans have the highest suicide rate compared to other ethnic groups. Additionally, they are 3 times more likely to commit suicide compared to other races. Suicide rate for white youths are 6.1% and 17.6% for non-Hispanic whites. Every year, 51.4 white males aged 85 or older commit suicide. Surprisingly, men are less likely than women to attempt suicide, but are more likely to succeed. Research shows post-traumatic syndrome among soldiers is contributing to an increase in suicide. What are the warning signs of suicidal thoughts? Most suicidal people will show warning signs to others, including constant direct or indirect threat to take one's life. Victims will search for ways to end their lives. Example, through the internet. Some may give up personal items in preparation. Victims withdraw from friends, family, and teammates and constantly talking about death. It is important for us to listen to them. They feel hopeless and burdened to others. Victims describe intense emotional distress and helplessness. What are the risk factors? Suicide has several causes. Individuals with mental illnesses, including depression and bipolar disorders, as well as those recently discharged from psych facilities. Also, harmful repercussions of drug and alcohol abuse may lead to suicide. Impulsive behavior, disability, and chronic diseases have long been factors in suicide. Also, suicide in the family, past suicide attempt, and access to deadly weapons. Suicide is also possible as a result of chronic stress from breakups, rejection, divorce, and unemployment. How do victims commit suicide? Suicides using firearms are most prevalent in the United States. Other means include suffocation, strangulation, use of poisonous substances or overdosing drugs, a long fall from high places. However, for those with terminal diseases, euthanasia, a request to die, is becoming more accepted. How does suicide impact the families and the community at large? The greatest impact is friends and family of the bereaved experiencing major loss. Findings reveal suicide causes stigma towards the bereaved society. Society perceives them differently, and family is left with misery and intense emotions. Families are filled with guilt, sadness, remorse, and anger. Furthermore, suicide adds to community and society burdens. How do we prevent this health crisis? Most suicide victims ended their life due to lack of problem-solving skills. Educating and training victims about coping techniques can help reduce their occurrence. Utilizing available community resources and psychosocial support, advocacy in household, churches, and community to raise mental health awareness and discourage suicide is beneficial. Hospitalization for suicidal victims and easy access to mental care are essential. What are some of the suicide prevention guidelines? Professionals should understand their role as mental and physical health coaches. Rather than trying to predict suicide, professionals should concentrate on easing patient suffering. When a victim shows evidence of suicide attempts or threat, immediate action is required. Training community and professional service providers, including regulations for screening and training, are available. There are available helpline, telephone numbers, and the best we can do for someone who refuses care and is suicidal is to contact 911. Creating environments that are free of deadly weapons is a job anybody can do. Also, there are states, national laws and regulations restricting access to lethal weapons for persons in danger and allowing for involuntary hospitalization. What are the suicidal thought treatment options? For emergency situations, please call 911 or suicide hotlines. For non-emergency situations, psychotherapy helps victims learn to control suicidal emotion. Early mental illness treatment and post-discharge monitoring is essential. Mental illness treatment, such as antidepressant, antipsychotic, anti-anxiety medications, and other mental disease treatment, should be taken seriously. Likewise, addiction therapy, detoxification, and support group may help lower symptoms. And patients must adjust their lifestyle, engaging in physical activity and exercising, and know the coping mechanism, warning signs, avoid triggers, drugs, and violence, follow appointments, and take their medications as prescribed. Here are more emergency helpline phone numbers. To summarize this topic, compared to non-Hispanic whites, Native Americans commit the most suicides. In general, suicidal victims show signs before they act. If a victim threatens suicide, act quickly. Everyday efforts are required to prevent suicide. Medical interventions from clinicians and regulations from state and federal are crucial. Mental disease must be diagnosed and treated early. Finally, with education, support, and individual self-help skills, suicidal thoughts and mortality may be significantly reduced. Here are the answers to the pretest. And you can find more information here by clicking on the handout link. These are my references. And thank you for watching.